A weight loss journey, well, it's just that, especially with something like bariatric surgery.
Well, even with the non-invasive Orbera, it's important to have professionals like physician assistants, nurses, and dietitians take care of you from the beginning all the way through.
That's right. The approach, it was developed and delivered the best surgical outcomes in the region for Dr. Tom White's practice. Good to see you, Doctor.
Nice to have
Thanks
you
for stopping by.
Great to be back.
There's a number of different options out there for patients, right? Especially when you're talking about bariatric, but what type of procedures do you perform?
Well, we perform the laparoscopic sleeve gastrectomy, the Omaha Gastric Bypass, the lap band, and now we also have in addition the Orbera balloon. So it's really the whole spectrum of different procedures for different needs and fit different patients' kind of requests, as well as different BMIs, which is the body mass index. So for somebody that's 400 or 500 pounds, the Orbera balloon is probably not a great option. But for somebody that's 40, 50, 60 pounds overweight, then the balloon's a great option. Somebody that wouldn't have wanted the risk of the sleeve gastrectomy or the gastric bypass, the balloon is very safe, very effective, and can be done as an outpatient procedure.
You mentioned that 400 to 500 pound range. I mean, if a patient comes into you at that point, they might be looking at bariatric surgery as a last resort. They might have tried other things without success. And really, I don't want to overly overstate it, but I mean, it changes their life. I mean, at that point, when you're obese and you're not as active as you want to be, but how do you know for sure that you're a good candidate for it? Because it's not just about how much you weigh, but you've got to be in a good mental state to sort of embrace some of those lifestyle changes.
Absolutely, and we tell every single patient if they're not going to make some of the lifestyle changes, you can regain a lot, if not all, your weight unless you can change your behavior, change what types of food you're going to eat, and add some type of activity or exercise into your daily life pattern. So it really is about giving people that opportunity to hit that window of change where they can make those differences and get their lifestyle back.
Yeah, and we were just taking a look at that graphic, and maybe we want to back up a little bit. You're holding the balloon. That's the Orbera right there, and that's the procedure that we were seeing in that illustration. Let's break that down, and exactly what do you do in that procedure?
Very simple procedure, placed endoscopically. So we go with a scope and look into the stomach. We have an uninflated balloon that we put into the stomach and then inflate it with basically just saline or salt water, 600 cc's, which is about the size of a softball when it's totally inflated. And the way it works is it just occupies a space within the stomach that makes you feel full more quickly. So small portions are for the meals, and that's why you are able to take in less calories and lose the weight.
This is not permanent. The balloon's not permanent, though.
Correct.
Right?
So it's intended to stay in for 6 months, and then we go in with another endoscopic procedure. Basically, just pop the balloon, take the fluid out, and remove it, and it takes about 5 to 10 minutes for an outpatient procedure.
And how much weight could you expect to lose with Orbera?
The FDA trial showed about a 30 to 40% excess body weight loss. So if somebody's 100 pounds over their ideal weight, they would lose 30 to 40 pounds.
So as you were saying, if you've got 200 pounds to lose, this isn't the right choice.
Correct.
But with Orbera, if you've been trying to lose like 40 pounds forever and it's just not going anywhere, this might be a smart option for you.
And it's a great option because you don't have the inherent risks that we would have with any surgical procedure. It's a very safe procedure. If people want to come in and talk about this is a great option. And the other thing that makes this very successful is incorporating this into a comprehensive program. So that's where we have the dietitians, the exercise physiologists, myself, my physician assistant. So it really does make a big difference if you can get in and say, okay, what am I doing? Some things that I may not realize I'm doing to sabotage not losing weight.
Yeah, and that's what I want you to expand on a little bit, whether it's Orbera or bariatric. There's a reason why patients are choosing your practice over others. Break that down a little bit for us.
Well, we've been around for doing the bariatric or weight loss surgeries now for about 15 years, or actually over 15 years. I've done probably more laparoscopic weight loss surgeries than anybody in the region. We have a very accessible program. We have a great staff of people, and that's really what I think has been one of the successes of our program. When we started, it was just myself and my physician assistant that did everything. And as we've grown, we've added probably 10 to 15 people from the nurse navigators who will help get the insurance approvals to the dietitians, the whole staff, as well as the people in the hospital for people that are having the surgery that take care of those patients every single day. So.
If somebody's coming in maybe for bariatric surgery, they might have seen other doctors leading up to the point of coming to you. But with Orbera, do they have to have a referral from another physician to come in, or how do they start that part of the process?
So the good thing about the Orbera balloon is they don't need a referral. It's not covered by insurance, so we can take the insurance kind of hassles out of the equation. But the bad thing is it's not covered by insurance. So it is you have to pay out of pocket or pay with some type of financing program. And so that we can expedite the process. We still want to go through the educational process, but we can expedite it and take some of the insurance weights and hassles out of the equation.
It's
Okay.
a fascinating procedure. The ease of the. Do you call it an implant? Is it an implant?
It's
or
a device or
a
implant.
device?
And typically, most really good procedures are the simple, intuitively make
Yeah.
common sense.
It
So,
just works.
Yeah.
Well, if it's either side of this equation, right? If it's bariatric surgery and you're ready to make some big changes in your life, or it's that 30 or 40 pounds, it just isn't going anywhere, but you want to be like meaner and leaner and like feel better than you have in a long time, Orbera might be a better choice for you. But either way, you can learn more by visiting the website omahagastricballoon.com. That's specific to Orbera, and then we just showed you the office information for Dr. White.
Yeah, doctor. Thanks for coming in. One
Thank
last
you.
thing you wanted to add?
Yeah, it's not the looking better and feeling better is definitely one of the benefits
Yeah.
and one of the drivers. But losing that 30 to 40 pounds can really make a huge difference in diabetes, high blood pressure, and so it can make you a lot healthier as well as make you feel better and look
Getting off
better.
medications.
Right, and I
you've
just
seen
saw a
that.
study on belly fat and how that affects your overall health. So yeah, great point. Thanks,
Thank you,
doctor.
Dr. White.
Great, thank you.
Well, hummingbird.